Ready? Hi
You're,
guys, thank Hi guys, thank you for joining. This is Essence of Medicine, and today we're talking about traumatic brain injuries. I'm Amanda Armagost.
and I'm Dr. Bossi for Essence.
Hi, thank Hi guys, thank you.
Let's
Let's
start
start
it
over.
one more time.
Hi guys, thank you for joining. This is Essence of Medicine, and sorry. Hi guys, thank you for joining. Stop laughing. Hi guys, thank you for joining. This is Essence of Medicine. I'm Amanda Armagost, and today we're talking about traumatic brain injuries.
I'm Dr. Bossi for Essence. And Amanda, you may know I'm a neurosurgeon, right?
That's why I chose this topic.
Yeah, this is right my alley because we see a big part of what a neurosurgeon does is dealing with the brain and head trauma. And something you may not know is that about 80 to maybe even more percent of the people who die of a trauma, they die of brain injury, meaning that imagine you're in a car accident. Your body is so big, right? You get injured everywhere, but 80% of the time when you die because of the head trauma and brain injury.
I would have guessed it would have been bleeding out.
Yeah, you would have thought that, but in reality, is actually brain injuries what kills the people in most of motor vehicle accident. And because that's the most vital structure. That brain is who we are. And as a matter of fact, it was just, I think, for the last 30, 40 years, we have even changed the definition of death. For a long time, death it was, a dead person was a person who wasn't reacting and so on and so forth, or heart stop beating and so on. But the current definition of the death is somebody who has no brain function. The heart can beat, the rest of the body can be alive. But if the brain doesn't work, that's the definition of an individual being dead.
That's always, that's actually like something that's pretty interesting to me that we, some people, I don't know about the medical community, but I know outside those people sometimes say that life starts at the heartbeat, but why does life end at loss of brain function? You would think that life starts at brain function, right?
Well, we don't have an exact definition we have a legal definition. I mean, listen, and sperm is alive.
Yeah.
So if you want to take that back, life starts as soon as the sperm leaves the male genital organ. I don't care. But we have a definition, legal definition of life, which start at birth, and a legal definition of end of life now, which is when the brain ceases to function.
Okay.
But obviously, there are lots of theological and other definition and so on and so forth. And in medicine, we usually have as well accepted that we take it the same way, that the life starts with the birth and ends with as a matter of fact, the legal community took it from us in the medical field that's how we define an individual or a person. So but I think that is your the surprise that you would have thought people bleed out in injury and so on is not it's not untypical. Most of people don't know that even though people get injured a lot, when people die, more than 80% to sometimes even 90% is because of the injury to the brain. And injury to the brain comes in very different variation. And obviously, um, the brain is a very sensitive organ. I'm sure you never have looked at an actual brain, have you?
Not in person.
It in a real person, it is like a pudding, like a jello. It's very soft actually. It has a membrane over it that keep it form, but once it has a very tough membrane over the brain. It's called dura. And I have to give you a little background about dura. Dura means tough, but the real name is
Durable.
durable. Yes, yes, dura. the durable comes from dura, is Latin for tough. The actual name of that membrane is dura mater. It's dura mater because underneath is a soft membrane. We call that pia mater. An official name was used to be dura mater and pia mater, meaning tough mother and soft mother.
Okay.
And once you peel it back, on the top of the brain, still the pia mater. Pia, like pious, comes from the same word. Pia means soft. And literally, then when you take as well dura mater and pia mater, then there is another even softer membrane. We call that arachnoid. Arachnoid comes from, have you heard that like arachnophobia?
No, I haven't.
No, but arachnophobia is a fear of spiders. But why do we call first dura mater, tough mother, then pia mater, soft mother, and then arachnoid, meaning spider web thing? Why do we call it that way? Because
Is that when like the veins and stuff are starting to spider out?
yes, 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 exactly that. Because the vascular supply to the brain goes through the arachnoid membrane. It's a membrane, but these vessels, like legs of a spider, they go everywhere. And when we saw it first time, the anatomy saw it for the first time, saying, "Oh, look like a web of a spider. Let's call it arachnoid." But why do we call that tough membrane around the brain? Why do we call it tough mother, dura mater?
Is it like creating the rest of the brain?
You have a very good sense of deduction. The Arab anatomist, they thought that it gives birth to the brain. They thought that. We know now it's not the case.
Okay.
As a matter of fact, that comes from completely different original origin in our embryology than the brain itself. But we didn't know better. They thought it gives birth, so they called it the tough mother because they thought that this membranes is what produces, what makes the brain.
Okay.
So now we have talked about. Before we talk about traumatic brain injury, let's talk about a little anatomy. So first we have the skin. Under the skin, we have a very tough membrane. Not that membrane around the brain, under the skin above the bone. We call that gallia. Underneath, we have bone, calvarium, we call it. Underneath, we have tough mother, dura. Then we have soft mother, pia. Then we have arachnoid. Then we have the brain. Have you been counting?
No, sorry, I haven't been counting.
Lots of layers, right?
Mhm.
To protect what and who we are.
Yeah,
To
but once I remember I learned this from you recently. You might remember the situation. When you hit your head, is that skin very thin or something? Because I swear you hit your head and you've never seen so much blood in your life. You
Yes,
bleed so much from the head.
good observation. That happened to you, right?
Yeah, I was so scared. I thought I was gonna bleed out.
Okay. Well, you wouldn't be the first to notice that like imagine you have seen me doing spine surgery. I make a cut and I stuff it in and so on, and I move forward. You cannot do that to the scalp. As a matter of fact, if you do that, patient will bleed out from the skull. Skull or head is the most valuable asset biology has given us. And for that reason, it is it perfused more than anything. Our scalp is more perfused than any other part of our skin, and our brain is more perfused than any part of our body. As a matter of fact, right now, even if you don't work out, if you're sitting there, about 40% of your blood supply goes to your brain. Your brain is about 1/20th, 1/30th of your weight, but 40%, so your brain is about 2 to 4% of your body weight, but it requires 40% of your blood supply right now.
Wow.
Can you imagine that? And scalp, it even though it's a very small part, as a matter of fact, is less than 4% of your skin. It takes more than 10-15% of your blood supply. And literally, when we cut in the skin, when we do brain surgery, there are clips. We put those clips to literally squeeze those vessels. Otherwise, patient will bleed out from the skull. But do you know why it's important? It's important because it has to heal fast. You cannot afford, you can have a injury to your arm, you can cut off your arm, you still will survive. But if it doesn't heal in the head area, and your chances of survival goes down really fast. So coming back to a macabre thing that they used to sculpt people, they would sculpt them to kill them because most of them would then literally bleed out and die.
Mm-hmm.
It wasn't like well, maybe it was a trophy thing as well and so on, but that was the easiest way to make sure somebody dies slowly or fast or whatever. So but you can have, when you hit your head, certainly you can injure the skin and so on. They usually, if it's not really tremendous, it usually stops. Okay. But that's not dangerous, life-threatening these days because everything outside of the skull can be between the skull and gallia, that tough membrane under the skin. Or it can be between the gallia and the bone. That these are two different. One moves easy, the other one moves harder if it's under the gallia. Obviously, it doesn't really bleed in the bone, but then it can bleed under the bone.
Yeah, internally.
Yes, it can internally. Then it's dangerous. Now, it can bleed between skull and tough membrane, dura. Since it is above the dura, we call that epidural hematoma. Hematoma meaning bleeding, epidural meaning above the dura. They are very localized and they then separate the dura, the membrane from the skull, and then it push directly on the brain. Most of the time after the trauma, that's what happens. And that can kill people. And it's something specific about that. And I have, unfortunately, a personal experience in my family with that. When I was very young, 14 years old, a cousin of mine had a motorcycle accident in a city that was about, at that time, it's not far away, but we didn't have highways and so on. It was just regular roads. It was about 6-7 hours from Tehran. And at that time, they didn't have these centers, neurosurgeon capacities in many places. It was very few places they had it. So this is the story I heard that my cousin, obviously I wasn't there myself, that had a motorcycle accident, lost consciousness, then regained consciousness and was okay, was all okay. But then an hour and a half later, he becomes lethargic, goes to coma and start seizing, convulsion. Obviously, at that time, they put him on the back of a pickup truck. And those pickup truck are not pickup truck you think of them today here. Those are very different. It is like, imagine you have a sedan, you cut up the back and you put a flatbed on the back. That's something like that. They put him there and they start driving to Tehran, and halfway he dies. And this is the textbook expression of a so-called epidural hematoma. That because when you hit, you injure, you break the bone, and part of the bone injures an artery. We call that middle meningeal artery that goes exactly in that tough membrane around here. And then initially the pressure stops it, but then it bleeds more and more and more. Eventually it becomes a size that pushes on the very crucial part of the brain. That's when people start having seizures, convulsion, and literally die. And he was the textbook, the way they described it. And all because nobody was there to make it, to save the patient. And I have saved a lot of patients that way. You make it, not doesn't have to be very big. You make a Incision in usually we do it depending on where it is, but generally we make an incision this way. Then
Wait, describe it for the people
like a
listening.
question mark that comes here, goes behind the ear and comes back here. Then we take a flap away. It takes literally 3 minutes to make, for me, used to take 3 minutes to make that flap. Then we make a hole in the skull, the size of like this big, and it takes another 3 minutes to make that thing. And then you take the bleeding out, you stop the bleeding. The origin of it is usually one of the major arteries here. You stop the bleeding, you put a coag, it takes literally 20 minutes, and then you close it. It takes 20 to half an hour to save a life.
I think we've talked about this before, but wasn't that the first type of surgery performed historically by the ancient
Yes,
Egyptians?
you're absolutely right. When in the old Egypt, when somebody starts, now they build pyramids, right? Somebody falls from a stone and hit the head, has the same thing and starts seizing, right? So
Yeah.
they think he's possessed by demons. How do they let the demon out of the head? By making a hole in the skull. So we have skull of the people that we know they have survived it because the bones start growing on the edges. So we have that. So and that was used to be like they had the tools to cut the stones. They use the same tool to make a hole. Somehow, I don't know how they learned. If somebody starts seizing, convulsing, if you make a hole in the skull, they survive. Somehow they found it out.
Really
Now,
interesting.
if you look carefully, you can't even say what side it's seizing because it's under the skin. You cannot see it with eyes. And if you don't have CAT scan MRIs, you don't know which way it is. But usually the seizure is always on the other side of the body. The one side start, and when it passes midline, then they seize both sides. So whatever side starts seizing, you have to put the hole on the other side.
Okay. I would have never guessed that.
Well, somehow 4,000 years ago, they figured it out. Obviously, the technique wasn't as refined, but I want to make clear to you this is what medicine is. A procedure that's 20 minutes now, we save a life, was deadly in my lifetime. Okay? So, that is when it bleeds between the skull and that tough membrane. But then we have that tough membrane and the soft membrane. Sometimes it bleed underneath. We call that subdural hematoma, meaning meaning on subway, uh, uh,
Under.
under submarine and so on, under the dura. We call that subdural hematoma. Subdural hematoma, in the face of it, is by itself is not as dangerous as epidural hematoma because it can spread out, it can equalize itself. But overall, they have worse prognosis because that's actually one of the board exam in neurosurgery. Because most of the people who have subdural hematoma have additional brain trauma. The subdural hematoma itself is not as dangerous as epidural hematoma, but if it's trauma related, most of the people who have subdural hematoma have extensive as well brain injury. That is why overall subdural hematoma has a worse prognosis. Because you remember, if it's just epidural, you make that hole, you save the life, you're done, you're good.
Hmm.
But if it's subdural, they have additional brain injury that is harder to recover from. And then it gets even more interesting. Then you remember that we said there is another layer, it's called arachnoid,
Yeah.
and it can bleed underneath. We call that, not surprisingly, subarachnoid hematoma. That usually happens if one of those spider web vessels there start bleeding, and often if there is a problem with the vessel itself, like an aneurysm and so on, that subarachnoid hemorrhage is usually sign of some vascular problem, that the vessel or an artery has a problem itself. And then we have, we are not done yet. We have when it bleeds into the brain itself. We call that intracerebral or intracerebellar, if it's in the back of the brain, hematoma.
And isn't like a brain injury? I don't know if this is true. A brain injury in the back of the brain kind of like the most dangerous.
Yes, it is. And the reason for that is it's close to where our heart center, our breathing center, brain stem is controlling our vital structure. Like, how many times do you think I have to breathe in or breathe out, or what should be my blood pressure, or the vital structure that you don't even think about? As a matter of fact, that's another thing that people don't know. You are aware of less than 1% of all the thing your brain does. Can you imagine that? You are consciously aware of less than 1% of the thing your brain does because 99% of it happens to just make that 1% that you consider to be you possible. All that emotional upheave, all the anger and all the happiness, all the laughter and so on is less than 1% of the function of your brain. The rest is everything happens underneath to keep your rest of the body going. Your heart is beating, your kidneys are controlled by your brain. Literally your muscle tone goes in and out. That like you don't even think about. Are you holding your hands right now under the table?
Well, I guess like I'm sitting on one of my hands and then my other hand is holding my arm.
Okay, so you see that there. You weren't thinking about it until I asked you about that, right?
Yeah.
Okay, and it gets better. I want you to really do that. Bring your arms up. Close your eyes. Take a weird shape with your arms. That's not a weird shape. Make it weird, really weird. Well, you can make my, okay. You see that in all those three locations, you can open your eyes now. You had a mental picture of what that looked like, right?
Yeah.
Imagine that. You weren't looking at it. The millions of sensory in your joint, in your muscle, they came all together. They gave that information to your brain, and your brain made the mental picture of that. And you were thinking about that 99 out of 100 times. You are doing all of that without you being aware of that. Like you were hitting your hand on the thing. You weren't thinking about that, but your hand was feeling your leg was feeling your hand. They were both giving signal to your brain. Can you imagine all the things going on there? And you have a mental picture of that you're not even aware of it, but it enables you to live. Okay, so coming back to that, we have an intracerebral bleeding, or in the back of the brain, intracerebellar bleeding, and that those are most dangerous because the most vital structure function of the body are controlled with our brain stem, which is in the back of our brain. Okay, and it makes sense as well because that is the oldest part of the brain. We call that archaeocerebellum. Archaeo meaning archaeology, right?
Yeah.
Archaeocerebellum, um, or cerebrum, is the oldest part of the brain, meaning we have the same thing that the reptiles have. So when you get hungry or hangry, when you
That's
go
just your primal instincts.
when you go full mode gremlin, that is your reptile brain telling you, eat it, eat whatever it's there. Oh, bite a boss's head off. That's your reptile brain telling you, give me something.
Yeah.
Okay? So come back to that, those intracerebral bleeding. But then it's not all of it. Then there is another layer. Inside of our brain, we have fluid chamber. We call that cerebrospinal fluid. Those chambers, we call them ventricles. And it can sometimes bleed into the ventricles. And those are usually can be dangerous because by the time trauma has gone so far to cause us intraventricular bleeding, that means there's lots of damage is already done. Okay.
Yeah.
And then there are some other obscure kind of bleeding. These are just the bleeding or the damage, but and the traumatic brain injury can be a combination of one of them with another or all of them.
Can you have traumatic brain injury without bleeding?
Yes, you can. Yes, you can. Yes, you can. And that is when, see, The bleeding is always an expression of a trauma, of an injury, because normal body has perfusion everywhere. And if the tissue is damaged there, automatically, like, can you have an injury to your arm without the bruise?
Yeah, I have a few right now.
No, you can't. You
What?
just, or listen to me now. It's getting interesting. You see the bruise when there is macroscopic, meaning a lot of blood out there. Every time you hit your arm and you say, ow, there's some macroscopic, minimal bleeding, but they're not enough to cause change of color there. What that means is that all living tissue are perfused. When there's a trauma there, some capillary, some small vessel get torn, then there is a bleeding. You just don't see it. It's too little for you to see.
What
Now,
about if I have an injury that is bleeding outside? It's the blood is coming out, but I don't see a bruise.
because because the bruise is not there, because the bleeding, all the blood is coming out. It doesn't go under the skin.
Okay.
You see the bruise when the blood goes under the skin and spread out. Now, that is where become interesting. There are few places in our body where we don't have much of a capillary. Like the vitreous part of the eye is one of them, cartilage is some of them, and very special part of the brain, like layers of the brain. Now, our brain are made of cell with a certain structure, and then there are glial cells that support them with the nutrition, but they are part of the brain that there are these axons, meaning that this path connection between these cells. There is not the actual blood supply there. The blood get there by perfusion. So obviously, if there's no blood supply there, then there is not a bleeding per se there. There might be bleeding outside of it, or it can bleed from outside, get there. So, but what I'm getting at, you ask me, can be injury without bleeding? The answer to that is yes.
Okay.
It's called the so-called axonal or shear injury. Imagine our my hand is a neuron, and this is another neuron, and they connect together with some path, okay? And then in trauma, they shear, they literally disconnect, or they go apart. We call that we call that axonal injury. And there are some other names for that depending on how bad and how far it is. And for a long time, we didn't really have tools to see it. But now we have MRI, high resolution MRI. You actually can see small little dots where you expect those accents. You see small little dots. And so we have come a long way. And then you literally see this patient, they're all okay, but then all of a sudden, 6 months after the trauma, their grades in the school go down. For a long time, we didn't really understand that. Or they become agitated. Like, there's something that unfortunately we learned it from war, that we call that um, this explosion, or um, there, in the different language, there are different names for that regarding to the wall, but more in some language they called it wave injury, because imagine you have explosion, the pressure is not localized, it's in your entire body, it's just a big pressure, and it moves you away. Guess what, your brain is swimming inside of your skull, like in a jar of water. So when you're moving away, the brain doesn't move at the same rate. So it gets shear injury of the brain. These people, they come back home, they appear externally okay, but then they have these anxieties, their performance goes down, they have these anger issues, they literally become emotionally unstable and so on. And for a long time, there are stories that, like, one of our big general in Second World War, if he would see one of these people, they would say this is just a weak person that faking because they didn't see any injury. And then some of them even got shot in place because this person is there, it's full totally, out of commission initially, and later on they have so-called traumatic brain injury and the trauma related, psychological problem. But initially, they can look normal from outside, but they're unresponsive. They don't react to you. They don't follow your orders. Some of them got executed because they thought these are cowards and uh, don't perform, don't go and do perform their duties in a war and so on.
Wow. So is that kind of like an extreme version of whiplash? Because I thought that when you have whiplash, it's the same thing. Your body moved and your brain was a little bit lagging.
Well, the whiplash is specifically, yes, it's the same mechanism, but specifically whiplash is for the motor vehicle accident, hitting from the back, and is spine injury in the neck.
Oh,
Whereas
okay.
I'm talking about the brain injury.
I thought whiplash had to do with the brain.
Now, whiplash is mostly neck injury, but in the same manner, the brain, we call it in the brain like when it's a one injury, we called it coup counter coup, meaning that you hit it here, brain wanna stay there, but the skull wanna go, so brain hits against the brain, and then the brain inside move to the other side, hits the other side, and then you have coup counter coup injury,
Okay.
or we call diffuse axonal injury. Okay, the AI, diffuse axonal injury, is when the small kind of injury in the axons and so on. And then there are some other terms that now we come to understand that there is a lot more. You remember we talked about those layers and so on and so
Yeah.
forth. These are all the things we know. There are tons of things we just are about to find out how our brain works. Now, literally, in a nut size of brain, there are more anatomy than in the rest of our body. And we just come to understand all of that. So traumatic brain injuries are, I would say, a vast majority of them are a combination of different kind of bleeding injuries that I was talking about. But depending on if that injury happens in this side of the brain versus this side of the brain, or farther down, they express themselves in a very, very different ways. And we
Hmm.
just about to understand that, what that really means. Another thing that we found out from sport injury, especially football, and I have no idea why Americans love this kind of very violent sport and so on. It's not long that we have rules now that they have to have a head.
Well, and the helmets that they wear are becoming very high tech because of
Yes.
all the brain injuries. But it's interesting you say that because recently I was with my friends and I was asking them if you had children, would you allow your children to play football? And all of them said no. They would not allow their children to play football because it's too dangerous. There's way too many concussions involved in football.
Um, and there's a story there as well, which is extremely sad. As a matter of fact, if you're interested, go watch that. I think Will Smith played that doctor in that movie, which is a true story about um, how this repeated injury on the brain express themselves. This is about lots of very hopeful um, school, college athlete playing football, and then they become invalid, and some of them died. And this doctor found out that this repeated hit in the head has caused this diffuse axonal injury, repeated diffuse axonal injury. And the problem with that is the first one you may not even notice, but if you accumulate them every time, they become 10 times more symptomatic and dangerous.
Isn't it
That
true
is why,
that, go ahead.
and that is why the rule is now if somebody has a traumatic brain injury, they sit out for the season. And that backfires because the kids don't say when they have it because they want to continue because the parent, the teacher, the coach, they all want them to just continue. That put pressure on them. Now, if they don't say that they have an injury, and that actually a little backfires now.
Yeah, well, I mean, it's kind of sport culture to walk it off. That's always what rub some dirt on it, walk it off.
You should
That's
not
always,
do that with brain injuries
yeah,
because
well, that's the culture. Not saying it's
now,
good,
yeah,
but isn't it true that every time you hit your head, you lose like some brain cells?
well, do you remember Muhammad Ali Clay?
Yeah, of course. Yeah, of
We
course.
were in the museum, right? You remember
Yeah.
in Kentucky, in Louisville, we were in the museum and so on. How did he die?
TBI?
Parkinson and TBI, yes, and severe Parkinson. And this is as well, we know from boxing and so on that every time you get a hit, 5 million neurons die. 5 million. Now, you have few billion. That's why it takes a lot of things to really put you there. But you'll be there. Eventually, you will be there. And that is, they have, and the football no different. Okay. So, um, and these are the information that we know now that you have certain number of the neuron. By the way, by the time you're born, you have more neurons than like you have probably now half of the brain cell, Amanda, that you had when you were born. All of us is the same. Um, I'm exaggerating maybe a little, but that is the reason why your brain is functional now. You see, when you're born, you have more cells than you need. But these cells are not connected. They are not myelinated. They are not functional. Once you start absorbing information, your brain organizes in a way to respond to stimuli, to respond to the rest of the world. And those cells that you use, they stay. Those cells that you don't use, they die until your brain is functional. That is why you should put your kids at a lots of exposure of lots of things. They should have as many experience as they can when they grow up, because then more cell have something. It is like brain cells are like one of those bored teenager. Do I have something to do? Oh, it's so boring. I want to die. And if they don't get something to do, they die.
Hmm.
Okay. But then after that, with the aging, you get less and less, but they become more organized. So coming back to that is that, but then it always goes down. But imagine you start with more, and use it or lose it applies nowhere more than to our brain. Learn a language, learn an experience, learn new experience, because then you make more connection and you give your brain more thing to work with. Both important, number of the cells and number of the connection they have. As a matter of fact, the number of the connection is even more important. And that makes many of these traumatic brain injury or diffuse axonal injury even more vicious, because even though they cut into the number of our brain cells, but they damage more connections, and that is even more important. So, and now we now understand if people come after this war and after explosion thing and so on, the personality change. We don't. I mean, I'm sure some people still do that, but we don't um, attach a negative intonation to people who after these wars and traumatic injuries, they have these emotional problems and so on and so forth, because we understand it is not a choice. It is a disease. Like, would you ever blame somebody who has
Autism.
cancer? You don't blame them for having. Well, some people do. They say, oh, you shouldn't have smoked and so on and so forth. I think I'm looking for
Like a
distinguishing.
severely autistic child, you're not going to blame them for like, who Scarlett. You're not going to blame her for destroying stuff.
Yeah, well, we understand this is out of their control.
Hmm.
Okay, whereas not long ago, and not long ago, I meaning in my lifetime, they would be blamed and this would be considered a choice.
Well, think about how we treated the Vietnam veterans when they came back.
Very poorly, very poorly. Yes, and now we understand and that many of these things are not a choice, and is that based on this repeated traumatic brain injury that they sustain in the explosion and the trauma that they sustain during their service.
Yeah.
So I could go on and talk a lot more about that, but I think that sort of wraps it up.
No, it doesn't because my main question hasn't been answered.
Which one is it?
So the whole reason why I wanted to do this podcast was because I saw a TikTok of a dad who had a traumatic brain injury. This was a long time ago, so I really don't remember the circumstances or anything like that, but he was stuck only saying two phrases. That's all he could like he could not say hello. He could not say yes, no, my name is. He could only say, I think, how are you? And do you need help? Or some like just two phrases. And it wasn't just like two words, phrases. So why is that?
Well, you remember when I talked to you about that, every part of the brain sometimes do something differently, but certain things are based on multiple of this location come together and produce a function. Now, in about 99% of the people who are right-handed, the center of our speech is on the left side. On people who are left-handed, it's, I would say, almost half-half. Half is on the right side, half is on the left. But the area that actually produces the speech, the language, the sentence, is very focalized. We call that a Broca center, which is about 2 inch. If you continue my finger, 2 inches about there. The part that makes you understand the language, meaning take your voice, noise, go to here, go to there, and make sense that this is a language and not like a just a metal hitting metal. That is about not here. This is the where we produce the language, Broca center. The other part is the what's called Wernicke center. It's back here, a little further back, about as well 2 inch into my head. And um, and what you're describing is somebody who has a speech combination of speech production problem. So meaning, I would say that person is probably has some problem with the Broca and some problem with the frontal brain injury. And depending on where that injury is, actual injury is, you can have symptoms like that, or you can have some people who just lose balance, or you can have some people who actually go blind. There's nothing wrong with their eyes, but they cannot see because the part of the brain, depending on what exact location in the brain is injured, you can have variation of an unbelievable amount of different symptoms. And this seems to be probably a left hemispheric frontal temporal injury that caused symptom you're describing.
But does medicine know why it's certain phrases? Like why is it that he says only these things and
No,
someone
that is,
else?
well, I can give you a speculation and a theory about that. Imagine when you produce language, you're relying on your our Broca center here, produce language, get the information from all the areas where the information and so on are stored. Imagine if those pathways, okay, let me give you an example that make sense to you. Imagine you go, you buy your milk from Trader Joe's, you buy your vegetables from Aldi, and you buy your cheese from a third store. Imagine the roads are destroyed, and you can only go to Trader Joe's, and all you can get is uh,
No.
milk, what you get from Trader Joe's. And then I come to your house and I see milk, 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 milk in your refrigerator and say, "What's wrong with you? Why do you have only milk?" This is the same way. You have to get the information you need for different things from multiple places. And if many of them, those paths, those axons that convey the message between areas of the brain are damaged, then you're limited. And
Okay.
then you can produce only a limited amount of responses. But that is language is only one of the way you are describing it. Imagine people, like you remember that you had this weird shape and you
Yeah.
could know exactly where your arms are. Imagine some other areas of the brain are damaged. All of a sudden, you have no control of your arm and hand. Or imagine that you have some abilities like sport abilities that you have an injury and then you lose them, or memories.
Yeah,
You all of a sudden you start. This is something we know the best about the memory,
mhm.
that people after injury they become forgetful. In some cases, they become forgetful about things that they knew in the past. In some cases, they get forgetful. We call that amnesia. Some retrograde amnesia, and meaning that you don't remember certain time before the injury because those memories are not consolidated in the long-term memory. Or you have anterograde amnesia, meaning that for a while you cannot create new memories, or you can have global amnesia and so on and so forth. So it's what you are describing is mostly about what area of the brain are damaged to what extent.
Okay. And what pathways, I guess.
Certainly.
Okay, well, thank you guys for watching. This was Essence of Medicine, and we talked about traumatic brain injury. I'm Amanda Armagast.
And I'm Dr. Abbasi for Essence.